Ni moheo nyithindo gana 700 wito ngimagi e piny mangima higa ka higa kokalo kuom tuo mar Numonia, gino maketo ngima mine mapek kod nyithindo matindo kamarach. Kuom mano, piny Kenya koro oseketo okenge mowinjore moting'o chulo omenda mar chanjo mar Numonia kaka yo mar kedo gi tuono. Kane olose e sach nyasi mar dhialo odiechieng' Numonia e piny mangima, Director mar weche Thieth Patrick Amoth nomedo ni piny Kenya osechopo atamalo 90 mar timo chanjo mar Numonia ne nyithindo. Koro ojiwo mana 10 counties mondo ne ni chanjo makamano ochopo kare.
Our pneumococcal vaccine coverage now stands at over 90%. We have expanded access to oxygen, pulse oximeters, and amoxicillin DT across our facilities, and our community health promoters, together with our healthcare workers, are detecting and referring pneumonia cases early, therefore saving lives.
Every 43 seconds, a child is lost to pneumonia. Prevention demands vaccination coverage of at least 90% against pneumonia-causing pathogens. And as a country, we continue to invest in our vaccination program, fully funded by the government. And for this financial year, Kenya government has already paid its full complement of resources to Gavi, the Global Vaccine Alliance, to ensure an uninterrupted supply of vaccines for our children and pregnant women. We will continue to work with the government, county governments, to strengthen the health ecosystem so that services are also brought closer to the people.
Wadhi yumo machuok tano kuseoro te magu kaendi wang'ino wacho nang'o kaendi kokalo kuom jodongo